Hang on. Got it. I think we are live. Meeting is live stream tubing. Okay, give me a quick second here. I think we are live. Okay. I am just kind of muting myself here. Hello, guys. Good morning. How are you? Can you guys hear me? Yes. Okay, we are just going to share the link of this. And I hope you guys are ready to learn math. Give me a quick second. I'm just trying to see here. Why does it say YouTube broadcast? Why is it saying private? Okay, let us just share this link. People are coming in. Okay, so let's just share the link with this one. Okay. All right, guys. How are you? It says 5 people watching. So just give me a quick second. I am going to share the link here with all the peeps. Wow, 28 watching. My goodness, this is such a beautiful, beautiful thing. Guys, can you please share our link? And we are here to study math, not mad math. We are going to study mathematics here today. And thank you. I want to say so much of your love for ECG class. It was beyond expectation. You know, this is what I would just say. This is amazing. Give me a quick second here. I will be sharing this link to our groups. So give me a quick second. Give me a Okay, guys. Can you guys hear me now? Yes. Okay, I was just posting the link here. Good morning, everybody. Good morning. Manpreet, Indra, Rutu Patel, Neenu, George, Himali. Good morning, everybody. Hi, can you guys hear me? Yes. Okay, perfect. Yes. Hi, Rutu. Rutu, can you hear me? Okay, perfect. Yes. So just give me a quick second here. We are just fixing this live stream. Good morning, everybody. And welcome to our Saturday class. Thank you so much for all your love. And it was amazing for the ECG class you guys have given us. I'm like so excited. And please help me out if you guys can share this link with your friends or in your study groups so that they can come and learn mathematics with us, okay? I will try to make this class as interesting as possible. And before I move on, I want to say thank you so much for your love. Like we were thinking that you are only like, I was laughing with you guys that do the 10K subscribers and, we will do the next session. But you guys rock the show. Like we have grown 5,000 followers in the last week itself, which is amazing. So I have a special announcement for you guys. We thought, like literally, we didn't thought, like we were thinking to give you guys, special souvenirs like FBNPC t-shirts and pens and stuff. But you guys have given us so much love that to all our, we will take the draw out from our subscribers. And guess what we are going to give you guys? We are going to give you guys Apple AirPods. Give me a thumbs up, and then we will pick out a name from the subscribers and, those who have recently subscribed to our channel. And we will take one name out and that lucky winner will get the AirPod. So make sure you guys stay tuned. We'll announce the winner and we'll do that with the team. We'll figure out, how to go through that because YouTube is pretty new for us. And we will do that for you guys. And we will deliver it. If you are staying in a country where we cannot deliver your AirPods, we will give you equivalent amount of cash for that. So thank you for giving us so much love on our YouTube. Yes. Charmi Patel, Manpreet, Rupinder, everybody. Good morning, guys. This is a beautiful, we want to start the class on a positive note. It's a positive motivation. So yes, Shaminder, yay. So make sure you guys share our channel with your friends and tell them to subscribe it. And today, by evening, we will be launching a special video for you guys, which we promised to you guys. It's going to happen either today evening or tomorrow morning, right? So stay tuned. Yes. And I'm here to see you to get positive vibes. Yes, I'm sending all my positive vibes here. And I am going to actually, lots of students are messaging me here. I am just going to share this for a news feed here. Give me a quick second. And who do you think is going to win the Apple AirPod? And if you guys will keep on giving us love, and I think it's our give back job. We have to give back to our community and our supporting, loving students. So maybe on, this is like, I think I can give you guys bigger targets now. So now this is the price for, like, we will announce the price. And this week, and once we hit the 20K followers, we will maybe higher up the price. Maybe, I don't know what it's going to be, but I will check it with the team and tell you guys in the next live what's going to be our price for that. But this is amazing. Okay, me. Okay, Sarah, Ojuma. Okay, awesome. Akruti, Kiranjeet. That's amazing, guys. Okay, so are you guys excited to study math today? What do you guys think? ECG, you guys loved it. And I know people, they don't like mathematics that much. And but let me know, do you guys like mathematics? Just put it in a chat box and then we'll go from there. I'll try my level best to teach you guys in a simplest manner and we'll do it. Yes, good morning. We'll try to do it in a very, very simplified manner, okay? And from NCLEX perspective, and of course, from the perspective of like, your real life as well. Like when you're working as a nurse, how are you going to, help the clients with this? Because the reason why it's very important for you guys to learn about math is that lots of nurses, they make a mistake in medication administration. And you guys know when we make mistake in medication administration, that's the time when a nurse can lose a license, right? And these are hardcore realities and people, they don't like to talk about it and they feel like, no, but this is the truth, okay? Okay, I think I'm pretty much all set up here and I am very excited to know who is going to win the, can you please let me know? Oh, GNM students can also pass NCLEX. There is, we have lots of students. My question to you guys is, guys, God has given us the same, like, brain, like, and if other person can do it, why do you think that they're, why can't you do it? This is my question, which I always ask to the students. So you have full-blown capability, doesn't matter. I feel like it's a more responsibility on teachers. If you have a wonderful teacher and a mentor, it's teacher's job to teach you. Any student can get trained with the proper training, as long as the student is maintaining the consistency and the student is willing to do the hard work, right? So yes, good morning, everybody. Okay, so nice to see you as well. Okay, so somebody's saying, how can I message on YouTube? Yeah, so watching live, yeah. So you guys can put it in a comment section and then we'll go from there, okay? All right, so are you guys excited? Yes. So today we will learn about, and this is a good way, like, people, those who can't come to the class, they can at least still join us once they are done or, back from work, because there are lots of nurses who work on the weekends. You guys know that there is no holiday pretty much for nurses here, right? Thank you, everybody. Sylvia, Dolly, Parminder, everybody, thanks. Welcome. And if you guys can please share this link with your friends or on your social medias, that's going to be awesome, so that they can also come and study live. So I can, okay, thank you. Yes, Sukhwant, you did FBN and NCLEX with us. Thank you so much for your love. You are amazing. Okay, so this is today we are going to study about med math, right? And I always laugh with the students. I was like, not mad math, it's med math, right? And Charmi Patel is here. Charmi, you were there last week as well, right? Good job. Okay, so this is hosted by FBNPC, and I'm myself, Karan Kaur. I am registered nurse. I do have my master's degree, and I am trained intensive care unit nurse with the certification in clinical and critical care. And I have been working as adjunct nursing professor and nursing instructor with Canadian college and university, and supporting internationally educated nurses since 2016. So that's my credentials. Just moving forward, I know you guys have already seen that in the ECG, so I'm not going to waste, again, whole time explaining about us. So this is our team, and I've already shared the incredible journey of our founder, and feel free to call us, guys. We are very approachable team, and we are not going to charge you guys anything for a counseling. So there is no charge for the phone call, right? If you are calling us and just simply asking, hey, this is what I have done, what can I do next? Our team is beautiful. They don't charge anything. Okay, so today we are going to work on, ma'am, please mention the NCLEX, sorry, please mention about NCLEX what, sorry, I'm just looking at the comments as well. Okay, guys, so let's just talk about this webinar. Today, I will help you guys with the basic conversions, principle of rounding up, Guru Mantra for your medication administration, types of medication, and then we will practice some formulas, right? That's what we are going to do today. And let's just talk about basic conversion. So tell me, you guys can raise your hands. Dolly is saying maths is stuff, not Dolly. Let's just talk after class. Well, Dolly has brought up a very valuable point. And now what I want you guys to do is on your notebooks, before we start this class, I want you guys to write what's your level in mathematics, like how comfortable you feel. Like 0 means like absolutely like you have no idea and clue. 10 means you are 10 on 10. And 5 means you feel like you are an average student in your numeric scoring, right? Like in numericals. How do you grade yourself? And yeah, so put that in. And then we will see how you guys feel after class, right? So this is how I like to evaluate my students, that what are they doing before and after class. It's very, very important. I'll try my level best to make it as simple as I can, but I need your calculators here ready. And I hope you guys have paper and pen ready to do this class with me. Okay, people are marking level 4, level 7. Okay, Charmi, you have done GNM. Amazing. So Charmi, you'll be okay. 2020 is just like very fresh. You have done it. Okay. So Charmi, make sure you share this link with your friends. Apne friends ke saath share kar do ye link. Okay. Yeah. So pichli bari, like, it was so much fun teaching live. So that's why I came back here again. Okay. So 4, 5, 4, 5. Okay, guys. So we'll see how you guys will feel after class, and then we will go from there. Okay. Okay. So I'm going to give you guys a very basic chart. Okay. Some people are saying 10 on 10. That's excellent. Amazing. So in this one, you guys should know that why nurses need to do the med math, because last time when I did this webinar with the students, lots of students were posting the comments, oh, you don't get question in the NCLEX about this. Well, leave aside NCLEX for some time. Think about it. As a nurse, you will be administering medication every single day of your life as a nurse. You will be probably assigned anywhere, depending upon if you're working in acute care or long-term care, anywhere from 5 to 25 patients. You have to give them a medication. And how are you going to give them the medication if you cannot calculate it? Think for yourself, right? So that's why in our classrooms, we do very elaborated mathematics. And that's why our students, they feel super strong when they go in the clinical or when they go into when they go and write NCLEX exam. So I will try my level best. In our classrooms, we spend around like 2-3 classes just to finish all the numericals. I know I have only half an hour, 45 minutes here, so I will do my best, whatever I can. Okay, Mandeep Gill is saying she's 10 on 10 because she studied from us. I really appreciate it. Thank you. So I have devised some simple things. That's why you guys would know why FBNPC has the highest results, because we teach the things in a very simple manner to the students, right? There are many ways you can do the things, but we focus on the simplified manner. So I want you guys to draw this chart with me in your notebooks, and this chart will help you a lot. And make sure you guys have your calculators to do the calculations, because I would need your help. Let's just learn the simple basic conversion first. So kilograms to grams, grams to milligrams, and then milligrams to micrograms. And I am going to write it here. Kilogram, gram, milligram, and microgram. And this is what I want to say. You guys should know that kilogram is the bigger entity. And that's why I draw a fat cat here for my students. You know, moti billi. So kilogram is bigger and microgram is the smallest entity. Okay, so small cat, choti billi. Okay. Now, students, they do lots of mistakes because they don't know basic conversion. Unko basic conversions hi nahi aate. So this is why we have made this chart for you, and keep this chart handy. So whenever you guys have to convert kilograms to grams, you need to multiply by 1000. Similarly, when you guys have to convert grams to milligrams, you need to multiply it by 1000. And then when you are converting milligrams to micrograms, guys, what do you need to do is multiply by 1000. Now, when you are doing opposite, then you have to do divide. Okay, so I'm going to change the color of my pen here. So let's just say if you're going from micrograms to milligrams, right? Somebody tells you, okay, convert micrograms to milligrams. So then what do you guys need to do is divide by 1000. And then if somebody tells you to convert milligrams to grams, again, what you're going to do is divide by 1000. And then again, somebody tells you to convert grams to kilograms. What are you going to do is divide by 1000. So keep this chart ready, and I'm going to do a couple of examples for you guys, and then I will give you guys 2 examples to solve, okay? So let's just say somebody tells me that you need to convert 50 kilograms to milligrams. Now, lots of people, they get confused, right? So now if you see here, guys, so kilogram to gram, this is one jump. And then from gram to milligram, you have to do the second jump. So moral of the story, अगर आपको किलोग्राम से milligram तक पहुंचना है, तो आपको 2 छलांगे लगानी है. You have to make 2 jumps. So this means 50 multiply by first 1000. So it's going to make it in grams. And then multiply by another 1000 to convert it into milligrams. So this means 5 and 1, 2, 3, 4, 5, 6, 7, 5, and then 7 zeros after 1, 2, 3, 4, 5, 6, 7 milligrams. Does that make sense? Everybody is okay with that? So when you're converting 50 kilograms to milligrams, you have to make 2 jumps. So multiply by 1000, then multiply by another 1000. Cool? Now let's just do second example. If somebody tells me that, Tharan, we have 1000 micrograms and you have to convert that into milligram. So that's what I tell the students. Keep this chart handy. This will help you so much. So now look at this. You are here, microgram, and then you want to convert where? To milligram. Means you are making a reverse jump. So if you are making a reverse jump, what do you need to do is you need to divide by 1000. Does that make sense? So when you're dividing it by 1000, what's going to happen is you will see 1000 divided by 1000. And please use calculators. Okay. I don't want you guys to, do this. Like just use the calculator if you guys can. And 1000 divided by 1000 is 1. So you guys know if we are converting 1000 micrograms to milligrams, so this means 1000 divided by 1000, it's going to be how much? 1 milligram. Is this clear? Give me thumbs up. And can you guys see my screen? Yes? Okay. If we are converting, sorry, I'm just checking here. Okay, perfect. Okay, are you guys ready for conversion? Yes. I am going to give you guys a question here if you guys are ready for the question, okay? So this is for you. I want you guys to challenge your mind. And again, don't beat yourself too hard. I want you to use the calculator if you are confused, okay? So here is the question for you guys. Let's just convert 68. So your question is, you have to convert 68 grams into micrograms. That's your first question. And second question I want you to do is, let's just say 708 milligrams, and I want you to convert it into grams. All right. So I'm going to give you guys some time, and you guys work on these questions before I solve it. Okay, this is a kind of class test for you guys. Good job. Use this chart and then do this. Oh my God, you guys are so smart. Like people are already calculating it and putting it here. So that is amazing. I am literally so proud of you guys. Okay. So if you see here, 68 grams. So you're converting grams into micrograms, right? So how many jumps you are making? Gram to milligram, then milligram to microgram. So this means 68 multiplied by 1000 multiplied by another 1000. So guys, did you get 68 and how many zeros behind it? 6 zeros. So 6, 8, 1, 2, 3, 4, 5, 6 micrograms. Did you guys get this answer? So that is amazing. Good job, guys. Good job, everybody. Now let's just see, convert 708 milligrams to grams. And you guys can, what we are doing now, we are making a reverse jump. So you're converting smaller entity, your milligram is small and gram is bigger. So when you convert the small to big, what you need to do is you need to divide. So 708 divided by 1000 will give you what? Grams. So please use your calculator. It should be 0.708 grams. Is this clear? Yes? Tell me. Everybody got it? Points? Yes, 0.708. Excellent. Good job, Mamta, Sylvia. Excellent. Good job, guys. Perfect. Okay. So if you guys are okay, keep this chart handy. This will help you and you guys will be pro and rock stars, right? So you guys should know this simple conversion chart. Okay. Now let's just move on forward and I'm going to teach you guys rounding up. This is also where lots and lots of nurses, they struggle a lot. And I will just do a couple of examples with you guys. But in our classrooms, we practice a lot of them. So in your NCLEX, what happens is whenever you write your NCLEX exam, they will give you in a numerical, they will exactly tell you what they need from you. So sometimes in your NCLEX exam, they would give you that they need the answer up to 1 decimal point, they need answer up to 2 decimal point, or they want the answer in the whole number, right? And in NCLEX, yeah, somebody is asking me, Charmy is asking, do we have calculator in NCLEX? That's a very good point. Yes, Charmy, you will get the calculator. It is inbuilt in your screen. So when you guys will be attempting the exam, and you will see that there is going to be a tab which says calculator. So that's why I tell my students to use the calculator. So don't get panic if you don't know manual calculations, you will get the calculator, okay? So now in NCLEX, they will ask you precisely, do they want 1 decimal, do they want 2 decimal, or do they want whole number? So I'm going to teach you guys how to do the rounding up, because that is where the students, they get stuck. So let's just say you got the answer by calculation 7.835. But in your NCLEX, they say that they only need answer in 1 decimal, up to 1 decimal point, up to 1 decimal. So now you have to convert this number up to 1 decimal point, right? So then now what you need to do is, I hope rounding up is a very simple principle, which we learn even in grade 4 and 5, but there are still some students who struggle with this. So rounding up means you start from the farthest right, and then you see if the number is 5 or more than 5, then you will add 1 number to the preceding digit. हिंदी में बताती हूँ, आपको सबसे लास्ट डिजिट देखनी है. अगर वो आपकी डिजिट 5 या 5 से ज्यादा है, तो आप जो उससे अगला नंबर है उसमें आप 1 ऐड कर देंगे. This is the principle of rounding up. So this means now you can see 5 is bigger than 5 or equivalent to 5. I am going to add here. So it's going to become what? 7.84. But NCLEX is asking you that you need answer up to 1 decimal point only. So then we have to round up again. So if you see this principle of rounding up, again, from the farthest side, you will see 4 is less than 5. So then what you're going to do is, you are going to add 1 here or not? No, you're not going to add 1 here, because 4 is less than 5. So this means when you will round up to 1 decimal, what's your answer? 7.8. So this means what will you type in your NCLEX exam? 7.8, because they have only asked you up to 1 decimal point. Okay. Now let's just do one more practice here. I'm gonna change the number here, 5.8324. Let's just say you calculated and you came here, but then NCLEX says we want the answer in whole number. So you have to convert this into whole number to give your answer in NCLEX. So again, as a nurse, you have to use the principle of rounding up. Aapko round up karna padega wahan pe, right? So you guys know what's the principle of rounding up? We start from the extreme farthest right number, and that number is, let's just say 4. 4 is less than 5. Will you add anything here? No. So first round up, after first round up, you will get 5.832. But you have to find the whole number, right? So we will still use the same principle. You will look at the farthest number, which is 2. 2 is less than 5. So will you add anything here? No, because 2 is less than 5. So in the next round up, our answer becomes 5.83. Now we still have to round up. Again, look at the extreme number, which is 3. So 3 is less than 5. Will you add anything here? No. So this means it becomes 5.8. But again, we are still looking for a whole number. Now again, you will look at the farthest one, which is 5.8. And you guys know 8 is bigger than 5. So if 8 is bigger than 5, you're going to add 1 here. So then what's going to happen? It will become 6. So in your NCLEX exam, what you're going to do, and even in the real world when you're working as nurses, because sometimes we do round up numbers. So this means what's going to be your roundup number? Number 6. So what will you type in NCLEX? Number 6. I hope you guys are okay with this. So this is how, I am just giving you a little bit idea. We go way more in depth in our classrooms because we have a lot of time to teach to the students there, right? But this is what, as I said, we are here to support all the students. So next, I'm going to give you guys Guru Mantra. And those who don't know what Guru Mantra means, tips and tips by your teachers is called as Guru Mantra. And this is what I always say to my students, like, you need some tips. So here is, I'm going to give you guys one tip, those who are watching our NCLEX live here, or who will be watching a recording here. I am going to write a medication order for you guys, and probably this will solve a lot of your NCLEX question just by knowing one thing. Okay, so I'm going to write a physician order here. Injection morphine, 2 milligrams IV stat. Okay, let's just say, or I will do a couple of orders. This one, and I'm going to write another one. Injection morphine, 2 milligrams IV Q4 hourly. Okay, so I just showed you two different examples of medication here. And then you look here. So here is the Guru Mantra. Now let's just see. Whenever a doctor will write the order should have these 5 things. What are those 5 things? I'm going to change the color of the pen here for you guys. Number 1, form of medication. Number 2, name of medication. Number 3, dosage of medication. Number 4, route of medication. And number 5 is frequency. So here is your Guru Mantra with which you are going home today. Whenever you see a physician order should have these 5 things. If you don't see these 5 things in your NCLEX exam or in your real world, what are you going to do is, what's going to be your answer in the exam? You need to clarify the physician's order. Okay? Because if anything is missing, so for example, physician wrote injection morphine 2 milligram, but he did not write IV stat. So then think about it as a nurse. Can you think that do you want to give this patient medication orally, subcutaneously, intramuscular, IV? No, you cannot think, right? So as you cannot think, what do you think is going to happen? What do you think? You are going to make a med error, right? So these should have these 5 things. Okay. Ma'am, first may, sorry, I'm just reading the comments here. If क्योंकि my Claire Charmy first 1 decimal मांगता था and then the whole number था. Okay, clarify. Okay. Let's just see, I'm just going to go back here. I think people are getting conversion here. Yeah, so 5.83 Charmy. And so this was 3. And then we rounded up. And, because 3 is less than 5, so we did 5.8. And then 8 is bigger than 5. So when you round up, the number becomes 6. Okay. Yeah. Sorry, my live feed is like a little bit behind than this one, right? So did you guys learn today's class? So you're going to do a medication error. And this is your best NCLEX question. So I have solved a lot of questions for you guys in NCLEX just in one Guru Mantra. And that is, the medication should have how many things? Now you guys are all learning in my classroom. Medication should have 5 things. Medication order. Number 1, form of the medication, name of the medication, dosage of the medication, route of the medication, and frequency of the medication. If you're missing any of those things, you need to clarify with the physician, and that's going to be the best answer in the exam. Cool? Okay, guys. Now let's just move on to the different types of medication orders we have. And again, keeping the time crunch into mind, but you guys should know we have primarily 3 kinds of medication, which you can get in your NCLEX. You can get the questions on scheduled medications. Then you guys can get questions on PRN medications. And then you guys can get questions on stat medications. Okay. So scheduled means whatever is already prescribed and scheduled. For example, metoprolol, BID, right? Which means twice a day you have to give. PRN medications are given as necessary based on nursing assessment. And stat medications, you guys know, is most of the time those are urgent medications which you need to give it to the patient, right? So those are the different kind of medication. And again, sorry, I do have a time crunch here, but then in our classrooms, we elaborate every single, these, and then we show you guys, and whatever practically is done in the environment, we will show you guys everything and then, explain how it works. So I hope those who are attending the live, I want you guys home with this message that there are 3 kind of medications which you need to study for your NCLEX. Okay, so that is important. Okay, so I hope you guys are excited. So let's just practice a couple of formulas. So I'm going to do first formula with you guys. And the first formula is DD over DH multiplied by vehicle will give you amount to be given to the patient. Now, you guys must be thinking, what is DD, DH, or vehicle, right? So DD, guys, stands for desired dose. Okay. And what is desired dose? I tell the students to write RX. Desired dose means whatever is prescribed by your physician. So whatever your physician prescribes you is called as desired dose. Then DH stands for dose in hand. Means whatever is the availability, right? Wherever that dose is available. If the dose is available in the tablet forms, in the liquid forms, right? And how much is coming. For example, 5 milligrams in 1 ml, 10 milligrams in 1 ml. How is it coming, right? So that's your dose in hand. Whatever dose means, whatever dose is available. Okay. And then vehicle stands for, this is where a lot of students, they make mistake. Vehicle means, guys, form of medication. ये आप simplify करके लिख लीजिए. Form of medication. Form of medication means if it's a tablet or it's a capsule, it's going to be in number, right? And then we have liquid medications, and liquid medications will be in milliliters, right? So this is what you need to know. Either you're going to put it as a tablet or a capsule, or if it's a liquid one, it's going to be in milliliters. So desired dose over dose in hand multiplied by vehicle, vehicle means form of medication, will be equivalent to the dose the nurse will give to the patient. So that's the amount you need to give to the patient. Okay. So are you guys excited for the question practice? This will make more sense when we will do the numerical. So give me a thumbs up and tell me you guys are awake. I hope I'm not making it too boring for you guys, the mathematics. Give me a big thumbs up here. Okay. All right. So I'm going to give you guys a numerical, and then you guys will work on it. And then you guys will tell me, yes, Taran, we know it. I know some of these numericals can be done in a simpler form as well, but I always recommend you guys to keep practicing this formula, because when you guys will become nurses on the floor, sometimes some medications you need to still calculate using, as I said, this formula. I know sometimes, you want to do it on tips, but I would just say it's always a good idea if you do that, right? When I was teaching here at the university, here means I'm talking about Canada. When I was teaching at the university here, we would always recommend our students to use these formulas, even when you become nurses, so that you don't make mistakes. Okay, guys, here's the question for you. I'm going to change the color of the pen. Physician prescribed, I hope everybody knows it's written as RX. Physician prescribed 30 milligrams of diuretic to the patient. Okay. Pharmacy sends you medication in the form of tablet, where 1 tab is equal to 10 milligrams. How many tabs nurse will give? Okay, so this is your question. Okay. And I know you guys can quickly, do it verbally and orally, but I still want you to practice your formula if you want to, nail your NCLEX exam or, in your real world. So here, what is your DD? Desired doses. Desired doses, guys, your 30 milligrams, because doctor has told you to give 30 milligrams over DH. DH means dose in hand. So dose in hand means, guys, we have 10 milligram and that 10 milligram is in one tablet. So you guys know vehicle is the form of the medication. So now here you can see your milligram cancels your milligram. And this means how many tablets you want to give to the patient? 3 tablets. That's your answer. Make sense? So I'm going to give you guys a couple of minutes to absorb this. And then I will be teaching you guys, maybe I'll be doing a couple of more examples with you. Okay, I hope you guys are not getting bored. And thank you so much. Like still 90 people, 95, 96 people live studying, which is amazing. It's beautiful, guys. Thank you for your love. Okay, now, are you guys ready for the next question? Okay, let's just give you one more question here to challenge your mind. Okay, and we are using the same formula, okay? Okay, guys, here you go. The question here is, okay, here is the question on your screen. Doctor orders 25 milligrams of medication to the patient, right? And again, don't worry about those 5 things which I told you right now. We're just practicing the numericals, okay? And dose available is 5 milligrams per ml. How many mLs nurse will give? This is your question. Okay. Now, same formula. You guys need to implement desired dose. What is your desired dose, guys? What has doctor recommended you? So your DD is what? Your desired dose is 25 milligram. Dose available. How much dose is available? Is 5 milligrams. 5 milligrams in 1 ml or per ml. So I'm going to write 1 ml here because 5 milligram is available in 1 ml. So you guys can use your calculators. I am actually good with manual calculation, so I'm going to use manually, but you guys can do your calculation using a calculator. So milligram gets cancelled with milligrams. So 5 5s are 25. So this means nurse will give how many ml to the patient? 5 ml. And it's pronounced as mLs here, right? So 5 mLs. Right? So 5 mLs the nurse will give. Clear? Ready, Freddies? Bore to nahi ho gaye koi? So to nahi gaya? Right? So people are saying like, sometimes the mathematics, I hope it's not that boring, hey? But think about it, guys. Your 1 decimal here and there, your 1 digit can, play with someone's life. So that's why we have to be very careful, and because we don't want to do medication error. And you guys won't believe, you guys can go check it for yourself. And I'm not joking. It's all information is available on Google. You go, for example, you go to CNO and you go, CNO means College of Nurses of Ontario, I'm talking about. You go type CNO disciplinary actions on Google. You would see all the court cases which are going on, right? And then what medication error, what things, what mistakes the nurses make, right? So that's why you want to be very vigilant. It's a beautiful profession. You can always enjoy it, but we also need to learn, how to do our best in those settings, right? And that's what, as FBNPC, we are doing. We are coming here to support you guys. And then, we really appreciate what you guys do for us. You guys have always made FBNPC as the #1 choice for internationally educated nurses not just in Canada now, it's going everywhere. It's USA, Australia. We have our students from everywhere now. It's amazing. Okay, so can I give you guys now one question to practice? Okay, so I am going to give you guys one question and let's just see. And now I'm going to twist that question. So get ready for that twisted question for you guys, okay? And then you guys have to do your best. Okay, here you go. So here is a question for you. Doctor prescribed 0.25 gram of a medication to the patient, and dose available is 500 milligrams in 1 ml. Wow. How many mLs nurses will give? Okay, this is your question and take your time. I don't want to disclose it now, and you guys do it. And in the meantime, I'm going to take a pause and then I will solve it for you guys. Okay. So here you guys have already seen the twist. And always remember, that's why remember the first chart which I give you, the conversion chart at the beginning of the class, that remember, this is the tip which I'm going to give it to you guys. Okay, do you see a thing here? Doctor's order is in grams, but the medication comes in milligrams. So guys, you always need to make sure that your units are matchy. If your units are not matchy, you're going to make mistake in the real world as well as in your NCLEX. So number one thing, we will be doing a conversion. And how will you do the conversion? The conversion chart, which I have given you guys, right? So now you know your physician order is in grams. So it's a good idea if you can convert that into milligram first. So 0.25 grams. And now you guys can look into the chart, which I have given you. 0.25 grams multiplied by 1000. So it is going to become what? It is going to become 250 milligrams. So number one thing before you even start this question is you need to convert it first. So this is what? So now you guys know your doctor's orders is also in milligrams and dose in hand is also milligrams. Now you're okay to do this question. So now your desired dose is whatever is prescribed by the physician, 250 milligrams divided by dose in hand is what? 500 milligrams. And 500 milligrams is in 1 ml. So now if you have to calculate, right? And I know, as I said, I'm good with the manual calculation, but you guys can use a calculator. So your answer should be 0.5 ml. So did you guys understand this twist here? Yes? So that's how maths is simple. Of course, if you're paying attention and if you know the basic principles and the rules. So there are lots of things, which can be taught in mathematics. Okay. So, sorry guys, here you go. Let's just do one more. Are you guys up for one more formula or you guys are bored and sleeping? If you guys are bored and sleeping, then I'll pause the class here. If not, then we can do one more formula. And there are actually, guys, a couple of more. But again, as I said, with the time crunch, I won't be able to do all that because those formulas, they need some extra additional time. But you're more than welcome if you want to come and, see for yourself in our classrooms, you're more than welcome. We welcome all the students. Okay, so here you guys go, the second formula, because, I want to give you guys the benefit of it. You guys are coming here on our lives, on the weekend. This is beautiful. So, okay. Second formula, which we teach to our students is, guys, we have to calculate the pump rate, right? I hope you guys know that all the medications are given here via IV pump. So the formula for this one is total volume of the fluid, and total volume is whatever you want to give to the patient, right? The doctor prescribes you. And always remember, in this one, the total volume will be in ml, and your total time will be in hours. You really got to pay attention to it. Time is in hours, and that will give you the rate of your pump. And your rate will be what? In milliliters per hour. Okay. So now let's just solve a question. So let's just say physician prescribed 1 liter or 1000 ml. Let's just make it simple here. 1000 ml of Ringer's lactate to be administered over 10 hours. Calculate the rate. Very simple question. So they're just simply asking you at what rate the nurse will set up a pump. Okay. So now you guys know your total volume is what? 1000 ml. And your total time is what? 10 hours. So at what rate you guys will be setting up the pump? 1000 divided by 10, 100 ml per hour. So this means if the nurse will set up a pump at 100 ml per hour, she will be finishing the whole IV fluid in 10 hours. Clear? Give me a thumbs up on this, and then I will do one more practice question, okay? So you guys will be doing a practice question here, and then that will tell me that you are all good to go. Okie dokie, here is our question. So the question is, physician has prescribed 2000 ml of 0.9% NaCl, and this stands for normal saline, to be administered over 20 hours. At what rate the nurse will set up pump? This is a question for you guys, right? So what do you guys think here? Again, you will see your total volume is what? 2000 ml is your total volume divided by total time, which is 20 hours. So this means the nurse will set up a pump at 100 ml per hour. This is my calculation. So this means if the nurse will set up a pump at 100 ml per hour, then she will be delivering 2000 ml of the solution in 20 hours. Does that make sense? Okay, so let's just do this, and just waiting for you guys because there is a little bit time lag here. Okay, so now I hope you guys enjoyed learning. Like, you know, this is a very simple, I showed you, like, you know, just a very quick half an hour or 1 hour. And if you feel like this 1 hour can make a difference, think what our whole program can do for you guys, right? And you can see the power of FBNPC's teaching, that we are teaching live here. This is not a recording. This is not, you know, any editing. It is not like we have just prepared one topic and we are here. You guys can ask us anything live here. We are happy to answer. That showcases the experience. That showcases, you know, how technically or clinically sound your professors are, right? And this is how, as I said, we are confident in our programs. So I know I already made the special announcement for you guys. And that was, as I said, I had to like control myself, है ना? मैं चुप नहीं कर सकी है, मैं तो पहले ही announcement दस दी. So the special announcement was, I already told you, those who are our new subscribers, and out of those subscribers, one lucky winner will get the Apple AirPods. We will announce those. And now I think if you guys have enjoyed learning this classroom, then you guys know I can give you guys next target. Like we can give you the target of, how about 20K followers, 20,000, hey? So on 20,000 followers, we will announce a bigger prize than Apple AirPods, okay? So how can you guys help us? You guys can help us by subscribing to our channel, and please share it with your friends. The more you will share, the more probability you might win a prize, right? So the more share, and then, you know, the more and more subscribers they keep on coming, you know, the prize will become bigger and bigger. So this is, let's just see who's going to be the winner. We are very, very excited for that. And so guys, I hope you guys enjoyed learning today's session with us. And it is, you know, wonderful to see you guys and your enthusiasm, and like almost still 100 students live studying. And I hope you guys, you know, had a beautiful experience. And this is just a cute one, right? So yeah, so I'm just going to discard this notation here. Okay, so thank you for joining us live, and we are like super excited to see you guys. Let us know in the comments if you're still watching our video, or even if you're watching it after the live is done. What should we be teaching next? And are you guys enjoying these videos? What we are doing it for you guys, coming live and teaching you guys live. And another thing is that pretty soon, either today or tomorrow, we will be launching a clinical video, our first clinical video with you guys. And I'm sharing this information because, you know, you are the best ones who are, you know, we're doing this red carpet thingy, hey? So it's going to be so much fun. So watch our clinical videos, make sure you learn from them and implement those into your practices and become successful students. So this is our initiative. And I just want to say FBNPC cannot do it without your support. We can only work hard. We can do the things, we can generate, we can initiate the new ideas, we can be the inventors, we can innovate, but you guys tell us what to do. And our team is a very creative team. We just don't do the copycat thing that here we go, we do the copy and that's it. No, we are the leaders in this industry. So if you feel there is something which we can do for internationally educated nurses, always let us know. Give us your ideas, give us your suggestions, and we will be very happy to help you guys. Plus win the prizes on the top of it, okay? So put it here in your chat box, and yes, keep commenting here, guys. Now we are just doing the chit chat. So thank you so much for the med math session. And I hope you guys enjoyed learning those couple of formulas with us, and you're not too scared of it. And stay tuned for more ones, right? Now I'm here for general question session. And let me know here. I am just going to switch my screen back to here. Give me a quick second. And let me know if you guys have more questions for me, more queries, you know, anything you guys have. So I'm just doing the general session here now with you guys. Tell me the questions. You know, as teacher, I think we always love questions. Like we always want to know what our students want and what their needs are, like, you know, so we are like always pretty pumped and excited to do that. Any general questions in the comment section? No? Well, we made everything clear. That is cool. This is beautiful. Let me just see here. Yeah, so I was just looking into my live thing here. Okay. Yes, Charmy, draw factor formula, because draw factor formula is going to take time to teach. And then we have like, yeah, so those ones will take time, and we have like very restricted. Ritika, what tips and tricks and for okay, ABG class, pharmacological, some tips and tricks. Yes, we absolutely do that. Yes, we need videos on practical areas. They are coming. So that's what I'm telling you guys, that make sure you guys subscribe to our channel and share it. And I can definitely trust you guys. You know, you did an amazing job. I was thinking we will only, like, you know, I gave you guys a target of 10K followers. And then you have brought our followers to 12K, you know, 5,000 followers increase in 1 week. So you guys are amazing. You guys are rock star. Make sure you guys share our videos in the nursing colleges, in your groups, and everywhere, right? So that people can get to know because we want to put people on right track. We want to give them the right guidance. And again, no charge for counseling, no charge for counseling. So you can spread the word. Without you guys, we cannot do it. ABG analysis, you make everything easy. Yes, Dolly, that's what we do. And, there are lots of ways the thing can be done, but that's why you would see our success rate. We just don't say it. We actually have it. Yesterday only, we had 15 students who passed NCLEX-RN exam in one day, right? And there is a reason for it. Every student, they gave us this feedback that we have not learned the nursing in those 4 years, what we learn in 3 months with FBNPC. So I want to say thank you to all our students for such an amazing response and motivation they give it to us. That's why we wanted to share in our live classrooms here with you guys what we do, right? So there is no magic. There is no, people, they talk about weird things and, blah, blah, blah. They do this, they do this. No, we are open. We are very trustworthy organization, very truthful, honest. This is what we do. If you guys like it, if you are connected, we are here for you guys. There is nothing hidden in nursing. Everything is open, right? Yeah. Charmi Patel, you already subscribed to my channel. Thank you, Charmi. And if you are still in India, share it with your college. It's going to be like, we'll be very happy. Rashmi Shrestha, you shared it with your friends. Thank you so much, Rashmi. We really, really appreciate it. Yes. So you never know, we might have special prizes for the students down the road who are, supporting us in this channel and then sharing it everywhere. So that's why whatever we are doing it, launching clinical videos, whatever, you guys will be the first ones to see it, right? If you have subscribed to it. Scope of oncology nurses in Alberta. Oncology is amazing. That's a whole huge set of different, if I have to explain you. I myself actually did the oncology training as well here. And oncology program here in our Saskatchewan was for 1 year. So I did do that specialization part. However, I felt like oncology is not for me. I am more of a med surg and intensive care unit nurse. So that's why my specialization and my forte, I did it in that one. But I did oncology. Oncology has lots of scope. If you are somebody who loves to work there, yes, you can absolutely go for it. Okay, perfect. Sure, Ritika. Thank you so much, Ritika, for your help. And thank you very much, everybody, those who are here. And stay tuned. Let's just see who's going to be the winner for our Apple AirPods. Thank you for bringing our subscription to this. As I said, 5,000 followers increase in a week. We are very, very grateful to you guys. Thank you, Harpreet. Yes, that is true. And I don't want to just sit here and take the target, all the credit here. I want to give the credit to the entire team of FBNPC. People might think we are just teaching 2 hours, 3 hours, 4 hours. We are working round the clock behind the scenes. We are doing multiple projects right now. And that is all, as I said, of course, for our students and for our internationally educated nurses, because we want you guys to be successful in your careers. Go FBNPC, you guys will never regret and will pass the exam. Thank you so much, Amandeep, for supporting them. And that is true. We do our best. We are not saying that, that we'll do this, we'll do this. We actually deliver it. And our students, they speak it, like they speak about it. That's what the reality is. Yes, Sylvia. Sylvia, thank you so much. And we are proud to have you guys. We are so proud of our students. And that's so true. There are so many people who are out there in the industry delivering this program. But if you have chosen FBNPC, we are really grateful to you guys. And I can only sit down and say it on the live that we will do our best to make you guys successful. And that's what we can do, commitment from our side, our organization. Perfect. Thank you so much, guys, for wonderful. And stay tuned. Let's just see who's going to be the winner. And subscribe to our channel, share it with your friends. And today and tomorrow is going to be a big reveal. Our first clinical video is coming to help you guys. Okay. Yes, Navjot, we are very, very dedicated. Please take more classes like ECG. It was amazing. Thank you. And as per, I hope you guys enjoyed mathematics. I know every topic is like a little bit variable. So we are trying to cover all the difficult topics, which was making nurses scared. Sometimes some students, they would even tell me that, Taran, we don't want to write NCLEX. We are very scared to become nurses because of ECG and because of mathematics. So that's why we came and we delivered those topics that don't be scared. As long as you have a perfect mentor who can teach you those things, you should be good to go. Okay. Thank you, Avni Patel. Thank you for your love. And sorry if I didn't say your name. You guys are all amazing. Ma'am, kal live lecture hoga. Charvi Patel, कल नहीं होगा. We did it on Saturday. We'll try to do it next week. क्योंकि ना अब मेरे बैच शुरू हो गया है. So earlier I was like, we usually take kind of 1 month break in between. But now my batch has started, and I'm like, once the batch starts, we are very dedicated to our students because they have trusted us. They have chosen FBNPC over other people. So that's why we want to be fully committed to them. तभी जब हम एक बारी बैच शुरू कर लेते हैं, हम अगला बैच शुरू नहीं करते, क्योंकि हमें यह है कि जिनको हमने ले लिया, ये जो हमारे पास आ गए कोहोर्ट में, वी वांट देम टू पास. उनका पास होना हमारे लिए बहुत जरूरी है. वो हमारी सबसे बड़ी कमिटमेंट है. पर जब भी मुझे टाइम लगेगा, whenever I'll get time, we will do our best to come live and connect with you guys, and tell us the topics कि और क्या पढ़ाएं. क्लिनिकल वीडियोस के लिए भी मैं आपको टॉपिक्स पूछूंगी. सो मेक श्योर यू ऑल्सो फॉलो अस ऑन इंस्टाग्राम एंड ऑन टिकटॉक एज वेल. एंड देन फिर आप मुझे बताना कि कौन सी क्लिनिकल वीडियो हम करें and which clinical videos will help you guys, because some of you are working as nurses already and they are struggling in the clinical area. So batate jao topic and we will do it for you guys. Okay, perfect. Voice is always playing in my mind. Thank you so much, Navjot, much appreciated. And as I said, spread our videos to everybody. This, as I said, education is for everybody. Nursing is for all the nursing students. सिर्फ हमारे students नहीं, सबके लिए. We want to help everybody. जो किसी और के पास भी पढ़ रहे हैं, that's okay. है तो students ही है ना, and we want them to be successful nurses. नाम तो हमारा community का ही रोशन करेंगे ना, right? So it's all good. So please share it out. Okay, guys, are you going to post this live session on YouTube? Yes, Ritika. This will be posted on the YouTube as well. So feel free to share it. Okay. All right, guys. Thank you so much for your love. I appreciate it. Now you guys can go enjoy your weekend. You have learned something. So you started your day with a positivity, and then, you